Hello, gentlemen. Let's tackle a topic that is becoming increasingly common in the bedroom, yet is often shrouded in mystery and silence: anal sex. What's the real deal here? And more importantly, how can you and your partner explore this safely, sensually, and without risk? I'm Dr. Nerita, a urologist and pelvic surgeon with 12 years of experience. Today, we're going to have an honest medical conversation about the anatomy, the risks, and the non-negotiable rules for safe anal intercourse. This isn't about being judgmental, it's about being informed. Stay with me, because understanding a few key facts is the difference between an exciting experience and one that carries unnecessary risk. The first myth to dispel is that anal sex is rare or fringe. In fact, research suggests a significant portion of sexually active adults have engaged in it at some point. It's been depicted in art and culture for centuries. People seek it out for many reasons: the variety, the sense of novelty, a deeper feeling of intimacy, or just as a part of their connection with their partner. It's a normal aspect of human sexuality. However, here is the medical truth. The anus is not designed for penetration like the vagina. Biologically, the vaginal canal is self-lubricating, elastic, and designed to stretch. The anal canal is not. It's lined with thin, delicate tissue and is built for one main purpose: elimination, regulated by a ring of muscle called the anal sphincter. Practically, this means that if you approach anal sex with the same mindset and preparation as vaginal sex, you introduce real risks of injury and infection. The key is knowing how to adapt your approach to respect the anatomy. As a urologist, my concern centers on safety. The anal tissues are delicate, and the lining of the rectum is thin, what we call friable, meaning it bleeds easily when stressed or torn. Infection risk: when these tissues tear, even tiny microscopic tears, you are exposed to blood and bodily fluids. This is why anal sex carries a significantly higher risk of transmitting sexually transmitted infections, STIs, including HIV, HPV, syphilis, gonorrhea, and chlamydia, compared to other forms of intercourse. We simply cannot overlook this risk, which is why protection is non-negotiable unless both partners are 100% certain of their STI status and fluid. Injury risk: the anal sphincter is a ring of muscles that controls bowel movements. If anal sex is forced, rushed, or done without adequate preparation and lubrication, it can, in extremely rare cases, lead to injury to these muscles, which can result in long-term issues like fecal incontinence or accidents with stool. This isn't meant to scare you. It's meant to empower you with the knowledge to make it safe. To have safe, sensual, and truly enjoyable anal sex, you must follow these 3 simple but crucial rules. Think of them as the 3 pillars of anal safety. 1. Mistake: skipping the conversation and ignoring cues. The biggest mistake is assuming your partner is ready just because they agree. The emotional impact: true consent is continuous and enthusiastic. If a partner feels pressured, forced, or even slightly reluctant, the experience will be negative, stressful, and possibly painful. This violates dignity and trust in the relationship. The practical fix: communicate, communicate, communicate. Not just verbally, "Is this okay?" but pay attention to nonverbal cues. Slow, gentle introduction and constant check-ins are essential. The body needs time to relax and accept penetration, and that starts with emotional safety. 2. Mistake: going dry, the lubrication sin. As I mentioned, the anal canal does not create its own lubrication. Going dry is dangerous. The biological impact: friction is the enemy here. It leads to tearing, which leads to pain, and most critically, it creates those microscopic entry points for STIs. Lubrication reduces friction, protecting the fragile lining. The practical fix: use a generous amount of high-quality lubricant. We are talking about much more than you might use for vaginal sex. Water-based lubricants are often recommended as they are easy to clean up, but they do dry out quickly, so reapplication is mandatory. Silicone-based lubes last longer. Never use oil-based products with latex condoms, as oil degrades latex. 3. Mistake: ignoring protection, the STI risk. The most common mistake is assuming that since there's no pregnancy risk, there's no need for a condom. That is a serious and potentially life-altering assumption. The biological impact: the high rate of tissue tearing makes the rectum a very efficient route for viral and bacterial transmission. Protecting yourself and your partner from STIs is a fundamental act of care. The practical fix: always use a condom, unless you and your partner are in a strictly monogamous relationship, have both been recently tested, and have discussed the risks. For oral to anal contact, a dental dam is the recommended protective barrier. One final crucial safety rule. If you switch from anal to vaginal penetration, what is the single most important physical change you must make? You must remove the used condom and apply a brand new one to prevent introducing anal bacteria into the vagina, which can cause severe infections. To ensure your experience is safe, enjoyable, and gentle, follow this simple action plan. Start small and slow. If you are new to this, start with a lubricated finger or a toy with a flared base. We'll talk about toys in a moment. The key is allowing the anal sphincter muscle to relax gradually. Rushing is a recipe for pain and injury. Respect the stop sign. If you or your partner feel pain, not just the sensation of fullness, but real, sharp, or uncomfortable pain, or notice any significant bleeding, you must stop immediately. This is your body telling you something is wrong. Do not push through it. Sanitize your tools. If you use any sex toys, they must be specifically designed for anal use, meaning they have a flared base so they can't get lost inside the rectum. And after use, always sanitize them thoroughly before using them again, especially if they are going to be used vaginally. Gentlemen, anal sex, when done correctly, with communication, mutual respect, copious lubrication, and protection, can be a wonderful, intimate, and safe experience. It is about exploration and pleasure, not pain or performance. Your ability to enjoy intimacy throughout your life depends on your willingness to be informed, gentle, and respectful of your partner's anatomy and feelings. Don't let fear stop you from exploring, but don't let ignorance lead to harm. Be safe, be gentle, and prioritize pleasure over pressure. If you found this advice helpful, please share it with anyone who needs to hear this information. Hit the like button and subscribe to join our community focused on men's healthy, vital living. Remember, taking care of your health and the health of your partner is the ultimate act of love. Stay informed, stay healthy, and as always, take care of yourself because you are worth it. I'm Dr. Nerita, and I'll see you next time.